Doctors in Alabama and across the country are currently studying potential long-term effects COVID could have on children.
WAAY 31's Grace Campbell shows us what the studies reveal so far.
It's too soon to know the lifelong effects that COVID-19 will have on children, but one of the ER doctors here at Huntsville Hospital says one of the main concerns from the study is figuring out what the long-term lung function is going to be like for children who had COVID-19.
It kind of looks like potentially if you have a family member with COPD, it's kind of like that your lungs scar down and they don't function as well.
Dr. Jessica Branscombe with Huntsville Hospital says COVID-19 is seeming to have a similar effect on children's lungs as smoking would. Researchers are seeing if those effects will be temporary or if children's lungs will be permanently scarred. The long-haul effects of COVID are even making it harder for some kids to simply play around and be a kid.
You can wheeze, you can have decreased ability for playing sports, things like that, where you find yourself winded easier than you did before COVID.
Another concern she mentioned is the long-term effects of the multi-system inflammatory syndrome that some children got several weeks after having COVID, because that impacted basically every aspect of an affected child's body.
It attacks their hearts, their brains, their lungs, their kidneys. They can cause significant injury, and in some cases we even had some deaths in our pediatric patients.
She said a lot of the children who had the inflammatory syndrome are still suffering from heart problems even months after they've recovered from COVID-19. Reporting in Huntsville, Grace Campbell, WAAY 31 News.